Good evening. Welcome to this edition of the 411 Talk Song Radio Show. My name is Leon Jones. Tonight's topic, I'm going to talk about Lyme disease, symptoms, treatments, and prevention. Now, before we get into the topic, I must define what Lyme disease is. Basically, Lyme disease is an infectious disease caused by the bacteria Borrelia burgdorferi Sincolato. Now, Borrelia burgdorferi is transmitted by humans by a bite from an infected blackleg or deer tick. The tick becomes infected after feeding on infected deer or mice. A tick is to be present on the skin for 24 to 48 hours to transmit the infection. Now, most people with Lyme disease have no memory of a tick bite. Lyme disease was first reported in the town of Old Lyme, Connecticut in 1975. It's the most common tick-borne illness in Europe and the Pacific Northwest, Northeast, and Upper Midwest regions of the United States. Now, people who live or spend time in wooded areas are more likely to get this illness. People with domesticated animals that are let out into the wooded areas also have a higher risk of contracting Lyme disease. And when it comes to symptoms, Lyme disease occurs in 3 stages: early localized, early disseminated, and late disseminated. The symptoms that you will experience depend on what stage the disease is in. Now, stage 1 is the early localized disease. That's when symptoms of Lyme disease start in 1 to 2 weeks after a tick bite. One of the earliest signs is a bullseye rash, which is a sign that the bacteria is multiplying in the bloodstream. The rash occurs at the site of the tick bite as a central red spot surrounded by a clear spot with an area of redness at the edge. It may be warm to touch, but it isn't painful and it doesn't itch. The rash will disappear after 4 weeks. The formal name for this rash is erythema migrans. Now, erythema migrans is said to be the characteristic of Lyme disease. However, many people don't have this symptom. Now, some people have a rash that is solid red, while people with dark complexions may have a rash that resembles a bruise. Now, we have stage 2. That's the early disseminated Lyme disease. Now, that basically occurs several weeks after the tick bite. During this stage, the bacteria are beginning to spread throughout the body. It's characterized by flu-like symptoms such as chills, fever, enlarged lymph nodes, sore throat, vision changes, fatigue, muscle aches, headaches. Now, during the early disseminated Lyme disease, you will have a general feeling of being unwell. A rash may appear in other areas other than a tick bite, and neurological signs such as numbness, tingling, and Bell's palsy can also occur. The stage of Lyme disease can be complicated by meningitis and cardiac conduction disturbances. The symptoms of stage 1 and 2 can overlap. Now, stage 3, that's the late disseminated Lyme disease. Now, that occurs when the infection hasn't been treated in stages 1 and 2. Now, stage 3 can occur weeks, months, or even years after the tick bite. This stage is characterized by severe headaches, arthritis of 1 or more large joints, disturbances in heart rhythm, brain disorders that involve memory, sleep, and mood, short-term memory loss, difficulty concentrating, mental fogginess, problems following conversations, numbness in the arms, legs, hand, or feet. Now, if you have any of the symptoms, contact your doctor immediately. Now, when it comes to Lyme disease, how do we diagnose it? Or how is it diagnosed? The diagnosis of Lyme disease begins with an assessment of your health history and a physical exam. Blood tests are most reliable after a few weeks once the initial infection has been spotted, and also when antibodies are present. Your doctor may order these tests. Now, you have what they call ELISA. That's the enzyme-linked immunosorbent assay that's used to detect antibodies against the B. burgdorferi bacteria. Now, there's also the Western blot, and that can be used to perform a positive ELISA test. It checks for the presence of antibodies to the B. burgdorferi proteins. Now, B. burgdorferi is a bacteria. Now, you also have the polymerase chain reaction that's known as PCR. It's used to evaluate people with persistent Lyme arthritis or nervous system symptoms. It is performed on joint fluid or spinal fluid. Now, how is Lyme disease treated? Lyme disease is best treated when it's in its early stages. Early treatment is a simple 14 to 21 day course of oral antibiotics to eliminate all traces of the infection. Now, medications used to treat Lyme disease include doxycycline for adults and children older than 8 years old. Now, you have sulfaroxime and amoxicillin for adults, younger children, and women who are nursing or breastfeeding. Persistent or chronic Lyme disease is treated with intravenous antibiotics for a period of 14 to 21 days. This treatment, although this treatment eliminates the infection, your symptoms improve more slowly. It is unknown why symptoms like joint pain continue after the bacteria has been destroyed. Now, some doctors believe that persistent symptoms occur in people who are prone to anti-immune disease. Now, how to prevent Lyme disease? Now, Lyme disease prevention mostly involves decreasing your risk of experiencing a tick bite. Take the following steps that I'm going to give you to prevent tick bites. And it is summertime, and the weather is going to get hotter and more humid, particularly if you live in the Midwest, the South, and the Northeast. So when you're outside, particularly if you're in the woods, wear long pants and long sleeve shirts when you're outdoors. Make your yard unfriendly to ticks by clearing wooded areas. You must keep underbrush to a minimum and utilize putting wood piles in areas that have lots of sun. Again, you got to make your yard unfriendly by clearing wooded areas, keeping underbrush to a minimum, and putting wood piles in areas with lots of sun. Use insect repellent. Insect repellent with 10% DEET will protect you for a period of about 2 hours. Don't use more DEET than what is required for the time you will be outside, and don't use DEET on your hands or on the hands of young children or on the faces of children less than 2 months old. Oil of lemon eucalyptus gives the same protection as DEET when used in similar concentrations. It shouldn't be used on children under the age of 3. Now, be vigilant. Check your children, pets, and yourself for ticks. Don't assume that you can't be affected again. People can get Lyme disease more than once. Remove ticks with tweezers. Apply the tweezers near the end of the mouth and pull gently. Now check to be certain that all tick parts have been removed. Contact your doctor whenever a tick bites you or your loved ones. It's very important. Again, be careful with Lyme disease. And I believe if you treat it in time, you won't have to worry about it. But just as I told you, it's about utilizing common sense. It's making your property tick unfriendly. And when you do that, you will reduce your risk of getting Lyme disease. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Thursday, June 8th, 2017. You can tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest calling number is 215-383-5785. If you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now on this channel, I don't engage in debates, controversial issues, or emotional issues. Now if I do social issues, they're going to be for educational purposes only. And of course the social issue depends on how you as the receiver or the audience takes what's being presented. So it could be emotional, could be logical, just depends on the person. But I want to tell you this, I do not participate in drama or unnecessary bickering because it's counterproductive. This channel is for educational purposes only, and what I do here is give you information that's researched, and of course I apply my own personal experiences to help you understand how the real world works. Because if you don't know the system, you're going to struggle. So the information is realistic but positive because knowledge is power. And if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, please leave your comment in the comment section under the video. But make sure that your comments are pithy. No bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other. Have a wonderful and blessed night. Good night.